going to do an assessment of your hair, skin, and nails. If that's okay with you, if I record it for my class? Perfect. I'm going to wash my hands with soap and water. Can you tell me your first and last name?
Miguel Esparra.
And when is your birthday?
July 5th, 1996.
Perfect. I first have a few questions for you. Do you have a history of any skin cancer?
No, ma'am.
Okay. Do you lay out in the sun a lot or go to tanning beds? Okay. And when you are exposed to the sun, do you use sunscreen?
Most part.
Okay, good. So I'm going to start first by just looking at your skin. Just from looking at it, you have a proper color for your ethnicity. There's no evidence of cyanosis, which is a bluish coloring of your skin, no evidence of jaundice, which is a yellow coloring of your skin, and no erythema, which is redness, so that's good. I'm going to go ahead and touch your skin. It is smooth, it's warm, it's dry, and you have equal hair distribution on all 4 extremities. I do notice a few moles on your extremities, but there's one right here, 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 a few on your legs I see. They're round, they're less than 6 millimeters, they're light brown and dark brown, so there's no abnormality there, which is good. I'm going to check for skin turgor, so I'm going to, near your chest area, I'm going to pull your shirt back and I'm going to pinch your skin upward to check for mobility, and then just see how it comes down, which is turgor, and then see if it comes back into place, okay? Perfect. That's awesome. And then the next thing that I'm going to do is I'm going to check your scalp, if you mind taking your hat off for me. Okay, so we have dark brown and black hair color. Seems like there is symmetry of your hair, meaning both sides are equal of hair distribution. And I'm going to go ahead and feel your scalp, okay? And your texture is smooth. And I don't see any moles or lesions on your head. Check the other side, which is also a good thing. I do notice a little mole more near your forehead and your neck area, but just like the other ones, appropriate color, appropriate shape, and they're not bigger than 6 millimeters, which is good. I also noticed some facial hair. There is equal distribution there as well, and also some dark brown to black hair color, so that's good. And then one of the last assessments that I'm going to do is your skin, your nails. If you mind putting your hands out like this, your nail beds are pink, which is good. Your nail shape is round. Your nail bed is firm. Good. And then the profile, it's 160 degrees on those nails, which is what we want to see. I'm going to go ahead and check your feet as well. Also, nail beds are pink and round, firm, and 160 degree profile. So a few things that I want to talk to you about are how to recognize an abnormal mole, things to look out for. So the first one is asymmetry. If you have a mole and, let's say it's like a circular shape, if half of it is a different shape or just doesn't look the same as the other half of the mole, of that same mole, that's something to look out for. Border is B, and so that's if your edges are ragged or non-circular. C is for color. If the mole, that same mole has several different colors, let's say like black and brown and blue, that's concerning. D is for diameter. If the mole is bigger than 6 millimeters, you want to have someone take a look at it. And then E is evolving. So if the mole started off very small and then it just started growing, or the shape started changing or the color started changing, that's something that you also want to seek medical help for and to have that examined. Okay, thank you for letting me do my assessment on you today.
Thank you.